Hi, this is your Houston chiropractor, Dr. Gregory Johnson. And today we're going to be treating a patient who has had 4 failed back surgeries. The first one starting in 2001. She had a discectomy, laminectomy, that failed. She went through rehab. She's been through another back surgery to clean up the scar tissue, and then they put instrumentation in there, infused L3, 4, and 5. She had a horrible reaction to that, to the metal, so they actually had to remove the metal, do another surgery, and put titanium in there. That didn't work out with her medical rehab since 2001 until right now, which is 2013. She has been undergoing numerous pain management programs, orthopedic surgeons, neurosurgeons, physical medicine rehabilitation specialists, physical therapists, and she finally was referred to us, and she is now getting chiropractic biophysics for the first time ever since her problems developed in 2001. And after we get done here, I'm going to let her share with you how she's feeling about things, but I want to show you how we treat a patient who's had 4 back surgeries and the amount of fibrotic scar tissue that has developed in there, which has frozen her spine. When I first met her, she was walking on a cane and could barely even walk into her office. So first thing I'm going to have you do, Denise, is let's have you lie on your tummy. And you notice I have the headpiece tilted down a little bit. That's on purpose. And you notice she still has a little bit of a difficulty moving quickly, but you'll see after the adjustment that she moves a lot better. And you will be able to see, actually, just from visualization, that her right sacroiliac joint is differently aligned than the left one. When I check her leg length, her right leg is a ½ an inch shorter. Now when I bring it up, watch her whole pelvis raise way up in the air. Her legs are even already. That hurts already, doesn't it, Denise? Yeah, so we can't even bring that up. That's called a positive Knockless and Deerfield on the right. Now see, she has sacroiliac issues as a result of all these surgeries and fibrotic adhesions in scar tissue that has developed in these regions. So what no one ever addressed in her case was her pelvis and sacroiliac joints. And this is below the levels of the fusion, and I am adjusting the right sacroiliac joint, the sacrum on the right side, and if you notice I'm adjusting that from superior to inferior as well as in the Z-axis and the Y-axis. Now that's the left side of her sacrum, and then we're going to adjust her left sacroiliac right there. Now, here's where she's had the fusion, from right here to right here. So, we're still going to adjust these areas very lightly, because when the vertebra slip backwards, that's where the nerve opening is. This is in the Z-axis. Now you can feel the significant scar tissue that she has in there, but these adjustments, and that's why it's called biophysics, you know, the laws of thermodynamics, an object in motion tends to stay in motion, so when I use this drop piece in the Z-axis, the vertebra, when the table stops, the vertebra actually continues to slide forward and downward, and then we just do some real easy manipulations in her mid-thoracic spine, and excellent movement there. Now see, the other part of her rehabilitation that was never addressed was she started developing a severe forward head posture and antalgic posture. There you go, just breathe normal there, girl. Right there. Now, we're going to need to get in and work on these pelvic muscles right here, because they are very, very sore in the gluteus medius, maximus, and piriformis muscles. So we get right down in. You have to break this scar tissue up for them to get any kind of mobility back in their spine, and these are very painful, aren't they?
Yes.
Yes, they are. And I haven't even started on the real scar tissue area yet, which is right down here at the very base of her spine, right there. Yep. She usually sings a tune or two when we do this one. Yep. Yep. And see, you notice I'm pinching or pushing together the tissues laterally from the spinous processes and the transverse processes so that we can start getting a lumbar lordosis back into her spine. Now I'm adjusting L2 right above that and L1 right above that. And then we're going to move right up into her upper thoracics and cervicals. And I want you just to let this go in my hand. Excellent. See, I got movement all the way from T2 to her occiput on this one. And the same on this side. Now, she's had a forward head posture, which has also started developing a dowager's hump here in her upper back. So, with the therapy that we're doing on her, with the very specific adjustments, and as you'll see here in a second, the therapeutic exercise that we'll be doing. Now these are trigger points that she has in her trapezius muscles, levator scapula muscles, and rhomboid muscles. Very good. Now let's check her leg length again. It's exactly even, and just relax your legs. Now, look how much further we came up that time. Did that feel better that time?
Yes.
Yeah, much better movement there. But we still got just a little bit of counter rotation in her sacroiliac joint. So I'm going to unwind this basically. There we go, much better. Now this one, take a deep breath and just relax. I'm going to bring them up again. Much better. And see, her pelvis stays in position that time, so we know we got that. Let's go ahead and just roll over on your back for me, Denise. Now, she's moving about 50 times faster than she used to. She used to not even be able to get on the table the first time I saw her. Remember that?
Yes.
Yeah, she couldn't even get down on this table the first time we saw her. So now we're going to be taking and adjusting her atlas on the right there. And then I'm down in the lower cervical here. There at C5, C6, that was perfect. And we're going to pull her shoulders back to where they're supposed to be. And now you're going to see something very unique because I'm internally rotating her hip joint, and I'm also, because she's had severe knee problems, adjusting her knees and her hip joints simultaneously. As you notice, I'm internally rotating this entire leg, all the way the femur up to here. Excellent. Felt that all the way up, didn't you?
Yes.
Now, here's the part where we're going to stretch the hamstrings. Now see, she doesn't have a lot, but this is like double what she used to. Now push against me real hard. Good. Now relax. Okay, push. Very good. Now relax and breathe. And one more time. Very good. Now relax. Now look at that. We got her at 90 degrees with just 3 pushes against resistance. And you notice how I'm pulling her leg inside again. Okay, go ahead and push against me. Very good. Now relax. And you'll feel when you get to the tightness. Now push again. And relax. And one more time, please. Very good. See, again, we got both legs 90 degrees up from the table. That will help stretch out and remodel this scar tissue that she's developed in her thoracolumbar region as well as her lumbosacral and sacroiliac regions. Now, we've shown her how to get off the table sideways and sit up, so she's going to sit up and face towards Renee. There we go. There we sideways. There we go. And we're going to have you look straight ahead. Keep that chin up. So we've got her right shoulder already. Now we're getting her elbows and her wrist, as well as every single one of her fingers. So we are tracing the pathway all the way from her cervical spine all the way down to her hands and fingers, as well as the same thing on the left side here. There was the elbow right there. There's the wrist. There's the thumb, first finger, middle finger, ring finger, and the little finger right there. Perfect. Very good. Now, if you don't mind telling the audience how you have done just in a short period of time with chiropractic biophysics compared to 13 years of other types of medical care.
For 13 years, I've been in a lot of pain. Couldn't sleep, walked the floors many a nights crying. Been on a lot of pills, been addicted to a lot of pills. I got myself off of it. I said I didn't need that. And I found Dr. Johnson myself. I found him.
Yeah.
And when I found him, I got my adjusters them to approve. We got it approved. And the first time I came in here, he seen how I walked and he said, we have to get you in here as soon as possible. And I said, well, he's just going to be like the other chiropractors. But no. This is the best doctor in the world to me.
Well, thank you very much.
I mean, I give him all the praise to him.
We give God all the glory.
God
gets all the
God
glory.
sent me to him.
Yep.
Really and truly, because the first time I came to him and he started working on me, I felt the change. And everybody in my family sees a change in me. And I haven't even been taking any medicine at all. He's just been working on me. And 3 times a week. And I'm doing a lot better in my life.
This is a life changer, isn't it?
Yes.
And we're very happy for her. And we want to thank her for allowing us to do this video today. And we wanted to share her story with you on YouTube because I know a lot of you have had back surgery, and there's a lot of failed back surgeries, and I just want you to know that corrective chiropractic biophysics can in fact help people who have had 4, 5, 6, even 10, 12 surgeries, because you still have a spine and a nervous system, and until you get those things started lining up and functioning properly, they're just going to keep taking pills the rest of their life. So thank you again, Denise, and praise the Lord for her healing, and we will see you next time. This is your Houston chiropractor, Dr. Gregory Johnson.